Your physician has recommended percutaneous transluminal coronary angioplasty, PTCA, because there is a narrowing in one or more of your coronary arteries that prevents adequate blood flow to your heart. Thousands of people worldwide have been successfully treated for coronary artery disease with PTCA. The purpose of this videotape is to give you and your family a better understanding of coronary artery disease and of PTCA. The main focus will be on what you can expect from your PTCA experience and what will be expected from you. Advanced Cardiovascular Systems presents A Patient's Guide to PTCA. The heart is a muscle that pumps oxygen-filled blood to all parts of your body. In healthy adults, the heart is usually about the size of a closed fist and pumps approximately 1,900 gallons of blood every day through the circulatory system. The blood flows out from the heart through a large artery called the aorta. The coronary arteries branch from the aorta very close to the heart and carry oxygen-rich blood along the heart's surface and into the muscle itself. The three major coronary arteries are the right coronary artery, the left anterior descending, and the circumflex. They branch into smaller arteries that supply blood to every part of the heart muscle. Coronary artery disease. In coronary artery disease, the coronary arteries become narrow or blocked by a gradual buildup of fat within the artery, which reduces the blood flow to the heart muscle. This buildup is called atherosclerotic plaque, or simply plaque. If this plaque narrows the channel of the artery, it may be difficult for adequate quantities of blood to flow to the heart muscle. If the buildup reduces flow only mildly, there may be no noticeable symptoms at rest, or symptoms such as chest pressure may occur with increased activity or stress. Severe symptoms such as chest pain, angina pectoris, heart attack, myocardial infarction, or rhythm disturbances, arrhythmias, are signals that blood flow is significantly reduced. Any of the following risk factors may increase your chance of developing coronary artery disease: smoking, high blood pressure, high-fat, high-cholesterol diet, strong family history of coronary artery disease, diabetes, lack of exercise, obesity, being overweight, stress. Treatment of coronary artery disease. There are three basic ways to treat coronary artery disease: medication, coronary artery bypass graft surgery, and interventional procedures such as PTCA, percutaneous transluminal coronary angioplasty, atherectomy, and stent placement. The purpose of these treatments is to reduce or eliminate any symptoms or problems you may have and to decrease the risk of a heart attack. Medications can be used alone or in combination with any of the other treatments. Medications do not eliminate the narrowing, but they can help the heart work better and reduce chest pain. Coronary artery bypass graft surgery is performed under general anesthesia. Surgeons take a portion of a small blood vessel from the leg or chest and sew or graft one end of the bypass to the aorta and the other end to the coronary artery beyond the narrowed area. Blood from the aorta now flows through the new grafted vessel to the heart muscle, bypassing or avoiding the blockage. PTCA is a technique used to widen the narrowing in a coronary artery without surgery. PTCA, sometimes called coronary angioplasty, stands for percutaneous transluminal coronary angioplasty. Percutaneous indicates the procedure is done through the skin. Transluminal means that the procedure is done inside the artery. Coronary identifies the artery being treated as one on the heart. Angioplasty is the technique used to widen the narrowing in your coronary artery. The basic idea of PTCA is to position a small inflatable balloon within the narrowed section of the coronary artery. Inflation of the balloon reduces the narrowing to the point where it no longer interferes with blood flow to the heart muscle. This will be described in detail later in this videotape. The directional coronary atherectomy device is a catheter with a small mechanically driven cutter that shaves the plaque and stores it in a collection chamber. The plaque is then removed from the artery when the device is withdrawn. A stent is a small latticed stainless steel tube which is introduced into your blood vessel on a balloon catheter. The balloon is inflated, causing the stent to expand, pressing against the vessel wall. The stent stays in place permanently, holding the blood vessel open and improving blood flow. You and your doctor have chosen PTCA as the best treatment for you. Your doctor will explain the benefits and risks of PTCA. Some of these risks are similar to those of cardiac catheterization. There is the additional risk that the artery may become more narrowed or even close off during the procedure. If the artery cannot then be reopened, immediate bypass surgery may be necessary. There is also a possibility that the narrowed artery cannot be widened with the balloon catheter or other interventional procedures. If this happens, bypass surgery at a later date may be recommended. On admission to the hospital, your preparation prior to PTCA will include tests such as an ECG, a chest X-ray, and routine blood tests. When all of your questions have been answered, you will be asked to sign a consent form for PTCA. You may also be asked to sign a consent form for bypass surgery should it become necessary during angioplasty. Tell your doctor what medications you are taking and if you have any allergies, especially to X-ray dye or iodine. It is important to tell your doctor if you cannot take aspirin, since this and other medications are begun prior to PTCA and continued for several months thereafter. On the night before your PTCA, you may be asked not to eat or drink anything after midnight. If you have not already stopped smoking, your doctor may recommend you do so in preparation for the procedure. An intravenous tube or IV may be placed in a vein in your hand or arm before PTCA. Fluids or medications can be given quickly and easily through this tube if they are needed. Your nurse may give you some medication to help you relax before the procedure. The cath lab. Parts of the PTCA procedure are similar to the cardiac catheterization you may have had, but PTCA may take 1 or 2 hours longer. PTCA will be performed in the Heart Catheterization Laboratory, or cath lab. This room will be similar to the one where you had your cardiac catheterization. You will lie on an X-ray table. An X-ray camera will move over your chest during the procedure. The staff will monitor your heart by attaching several sticky patches to your chest and using a specialized ECG recorder and monitor. In preparation for your PTCA, the area where the catheters are to be inserted will be scrubbed with antiseptic solution, and you will be covered with sterile sheets. During your PTCA, you will be awake. From time to time, your doctor or a staff member may ask you to do something. It is important to listen for these instructions and do what is asked. Before starting the PTCA, your doctor will inject a local anesthetic where the catheters will be inserted. This may sting. After the injection, you may feel dull pressure where he is working with the catheters. Tell your doctor if you feel pain. The doctor will use either your arm or groin for the PTCA. Catheter introduction into the groin first requires that a small incision be made at your groin after local anesthesia has been given. An introducer sheath or short tube is then inserted into your femoral artery. Next, your doctor will insert a guiding catheter or long flexible tube into the introducer sheath and advance it through the aorta to where the coronary arteries branch off to the heart. Catheter introduction into the arm first requires that a small incision be made at the inside of your elbow after local anesthesia has been given. The guiding catheter is then inserted directly into the artery through the small incision and advanced to where the coronary arteries branch off to the heart. After the doctor inserts the guiding catheter, X-ray dye will be injected into your coronary arteries to review the location and severity of the narrowing. This will be watched on a monitor while it is being filmed. While your doctor is taking X-rays, you may be asked to take a deep breath and hold it for a few seconds. You may be able to watch the pictures on a monitor near you. Your doctor has selected a dilatation catheter that will be approximately the same size as your artery. This balloon catheter will be advanced to your coronary artery through the guiding catheter that was already inserted. A guide wire is advanced through the artery until it is beyond the narrowing. The balloon catheter is then advanced over the guide wire until it is inside the narrowing. The balloon has special radiopaque markers and is filled with X-ray dye, which enables your doctor to see it on the X-ray monitor. Once the balloon is placed across the narrowed area of the artery, it will be inflated. The inflated balloon opens up the narrowed artery by splitting and compressing the plaque and slightly stretching the artery wall. The doctor will tell you when the balloon is inflated. It is common to have some chest pain when the balloon is inflated because the blood flow through the artery is temporarily blocked. It is important to tell your doctor if you do have chest pain and how severe it is. If you do have chest pain, it should decrease when the balloon is deflated. The balloon may be inflated and deflated several times during the angioplasty. The first balloon may even be removed and other balloons used if additional stretching is required. When your doctor is satisfied that the plaque has been compressed and the artery has been opened sufficiently, the balloon catheter will be removed. By taking more X-rays of the artery, your doctor will see how much the blood flow has improved through the artery. After the PTCA, the guide wire and balloon will be removed. If your arm was used, the doctor will remove the catheters and sew the artery and incision closed and bandage the arm. If your groin was used, the guiding catheter will be removed and the introducer sheath secured. After PTCA. After you return to your room, your blood pressure will be frequently checked and your heart may be monitored. If your arm was used, you may be allowed to sit up, but may be asked to stay in bed for several hours. If your groin was used, you can also expect to stay in bed for several hours. While the introducer sheath is in place and for approximately 6 hours after it has been removed, lie flat on your back and keep the leg with the sheath straight and still. Although bleeding is unlikely from the groin, call the nurse at once if you feel a warm, wet sensation or sharp pain in the area of the puncture. Call the nurse if you are uncomfortable or need assistance with anything. Do not sit up until your nurse or doctor instructs you to do so. After successful PTCA, patients are usually sent home from the hospital in 1 or 2 days. You should arrange to have someone take you home rather than drive yourself. Take your medication unless your doctor tells you to stop. It is important to keep all follow-up appointments that are scheduled for you. Your doctor will want to follow your progress closely. If you have any questions, ask your doctor. It is important to call your doctor if you have chest pain. Chest pain may indicate the narrowing has returned. This happens in a small percentage of patients. Re-narrowing or restenosis can usually be treated with a second PTCA. The majority of patients who go home after successful PTCA have no further problems. Most likely, you will be feeling better than you have in a long time. A Patient's Guide to PTCA. Advanced Cardiovascular Systems.